morning, folks. Eric Roy here with my good buddy, Nitin Engineer. Nitin is a hand surgeon, reconstructive surgeon, and plastic surgeon here in Las Vegas. Good friend of mine. How are we doing today, Nitin?
Doing good, Eric. Thanks for having me.
Good to see you, buddy.
Yeah, likewise, bro.
So, first thing we want to talk about, I want to introduce my friend, Nitin. How long have you lived here in Las Vegas?
Since 2009.
All right. And Nitin is a very well accomplished surgeon here in Las Vegas. He's done, I know, at least 5,000 hand surgeries, if I'm not mistaken.
Yep.
Which is pretty incredible. But now he also does, and his primary focus, I believe, in addition to hand surgery, is reconstructive surgery and cosmetic surgery, otherwise known as plastic surgery. So we'll talk a little bit about that. Right now, me and Nitin have a case we're working together. I'm an injury attorney in Las Vegas, as some of you might know. I have a client. He was handcuffed for a period of time. Actually, he was handcuffed for about 3 hours. Those cuffs were so tight that my client, who's a local UNLV kid, about 29 years old, ended up getting some permanent injuries in his hand, which I thought was super. It was interesting that he ended up with some more long-lasting injuries from that. Nitin, you want to tell us about how that can happen?
Yeah, he had compressive neuropathy is what the term is for it, but essentially when you can have tightening of the handcuffs around the wrist, there's a very important nerve. There are three important nerves that serve the hand and the upper extremity. There's the median nerve, there's the ulnar nerve, and there's the radial nerve. But without getting too technical, the main one that gives you function and the ability to make a fist and have sensation to the major digits in your hand is the median nerve, and that goes through an area that everybody knows called the carpal tunnel.
Yes.
And when you have compression of that nerve for prolonged periods of time, that nerve can actually lose its blood supply, and the cells within the nerve, called the axons, start to die away. And it's almost like suffocating that nerve. And ultimately what happens is the patient will end up with permanent numbness, tingling, weakness of the hand, and this can be debilitating, especially if somebody wants to use their hands for their occupational duties and their normal activities of daily living. So that's what happened to this poor guy, and now he's living with it for a few years now.
Yeah, he is. And one thing that I thought was interesting that Nitin told me is once you have these nerve injuries, and I believe this goes for nerves anywhere in your body, doesn't just necessarily have to be in your hand. Once those nerves die off, I believe first of all, the longer you have compression or the longer they go without treatment, the less likely or the more prolonged the recovery. And what's interesting is once these nerves do die off, they will actually regenerate. Like if you get a cut on your arm, slowly scar tissue and cells will develop to heal the area. It's the same thing with the nerve, which is interesting. Your nerve will actually regenerate, if I'm not mistaken, at about the speed of about 1 inch per month, which I found fascinating.
Yeah, there's always a point of return to any type of damage. The nerve itself has an amazing ability to rehabilitate itself, to regenerate if you catch it at a reasonable time. But you can end up with permanent nerve damage if you have prolonged periods of compression. But if you catch it before that, the nerve will heal at about 1 millimeter a day, which is about 30 millimeters a month, which is a month. So that's where that number comes from, and it's fascinating how that nerve can regenerate and reconnect to the main brain and central nervous system and start functioning again. And that's the whole principle behind carpal tunnel release procedures and so on. You want to catch it early. You want to catch it at a point where the patient is starting to have symptoms, but has the ability to rehabilitate and get back to their normal.
I wanted to ask you, so when I was in college, I boxed for UNLV, and I was sparring with a buddy of mine. He's also on the team, big guy. His name is Henry, and he hit me with a left hook right to the face. And when he hit me, I heard a very loud cracking. Then I went and looked over in the mirror, and my nose was on the side of my face. It was rather horrific, honestly. So I was like, I got two options. I can live the rest of my life with my nose on the side of my face, or I can go to a surgeon and get my nose put back on straight. So I went to a surgeon in town, and he did put my nose back on straight. Now at the time I was, like 21 years old, so I didn't think to talk about the entire procedure and the nasal passages and all that. But what I did notice following the procedure, my nose was straight, but I have felt like my breathing out of one of my nostrils always felt like it wasn't as good as it is on the other side. And I don't know if it was because of the surgery or because of the hit, but I'm sure you've had experiences similar to mine that you've dealt with.
Absolutely. Well, the nose is a very complex part of our body. It serves as an aesthetic unit. It's what gives us our personality. When people look at us, you know, a lot of people focus in on the nose, so that's number one.
Yes.
But it's also functional. It's what gives us the ability to breathe and take in air. So when you have an injury like that, the nose has a certain foundation. The foundation is the bone, which is the nasal bone, which is the hard part of the nose. And about 2/3 of the way up the nose from the tip, the cartilage meets the bone, and that's where your nose is pretty soft. And that is really made up of a series of cartilages. There's the lower lateral cartilage, the upper lateral cartilage, and the septum. And the septum is the foundation of that. And the septum should go straight down the middle, and it separates the right and the left airways. But when you have a fracture or an injury of that sort, the nasal bone is shifted over, and the septum goes with it, and it can actually deviate. The septum becomes almost curved or warped. And so you can imagine that warped cartilage is now pressing up against the side of the nose, and that's limiting airflow through one nasal passageway, but the other nasal passageway may still be able to take in air. So that's really the foundation of what happened to you.
Yes.
And what you have experienced, even way after that. So it's important to realize that it's complex, and that septum also needs to be corrected, which can be corrected later on. We call it a septoplasty. So we actually take the septum and we realign it. Sometimes you have to take out a portion of that warped cartilage so you can straighten it, and the patient can breathe.
Wow. That's very interesting. Now I was reading, and I found this very fascinating, that actually these nose surgeries, and probably other surgeries as well, Nitin will be able to educate us on this. A lot of these surgeries began BC, some of them like 2000, 2500, 3000 BC. So I would, initially I thought, plastic surgery has been around. I would have assumed 50 years, 100 years. Little did I know they've been around for 5,000 years.
Yeah.
So from my understanding, they pretty much started in India. There's some ancient scripts that they pulled up where they've written down the instructions on how to do a rhinoplasty, which is a nose surgery at the time. And then it sounds like, then you had World War I, World War II, where these guys were getting shot in the face. And it was either live the rest of your life with a hole in the side of your face, or somebody needs to try to do something about it. So they would do these crazy surgeries, hundreds and thousands of years ago. I thought that was pretty fascinating.
Yeah, that's the coolest thing about plastic surgery. Is the oldest surgical specialty. It goes back to India.
Okay.
Started with reconstructive procedures really based around the nose and various wounds and so on. Sushruta was a famous plastic surgeon about 5,000 years ago, and what he and don't hold me to that date, but it goes back thousands of years. So when you would have criminals or patients with leprosy that would lose their nose due to disease processes, or because one of the punishments for crimes back in the day was to chop off your nose. To reconstruct the nose, what they would do is actually take the upper arm, sew it to the face, and use the upper arm tissue to build the nose from scratch, which is really interesting. And we're using very similar techniques today. Actually, we use the forehead. We can actually take the skin from the forehead and swing it around and reconstruct the nose using rib grafts to create the foundation and the structure of the nose, which is some of the most interesting stuff that I take care of. When you have patients with cancer, like a basal cell cancer or squamous cell cancer of the nose, or a melanoma, or whatever it may be, it really destroys the skin and the cartilage and the foundation of the nose, and you need to reconstruct that to give these patients that aesthetic appearance, because once again, the nose is the center of the face, is what people look at. So fast forward to the 1800s, 1900s, yes, you're absolutely correct. When the war came around, the plastic surgeons were the guys that were left at the end of the day trying to figure out how to help these soldiers.
Right.
And it wasn't a very glorified position. It's not the plastic surgery that you see today on TV and the cosmetic stuff that we do, but it was the nitty-gritty. It was the core of taking care of people and taking care of soldiers and taking care of patients that really need help.
Yes. And the other thing which was interesting about that is back in those days, when they're doing these surgeries in the 1800s and 1900s, they didn't have the types of painkillers that they have now. I think they didn't even have any painkillers other than maybe whiskey or whatever it might be. So when you underwent a procedure in those days, you felt some pain.
You're biting down on
you
the
really
stick,
needed
man.
that surgery. Yeah.
Yeah, it's interesting. I think that's been one of the greatest advances in medicine too, is the level of anesthesia that we have today.
Yes.
I give a lot of credit to my anesthesia colleagues. I've been working with the same group for the past 10 years, and they're phenomenal. But anesthesia is modern medicine's greatest contribution to be able to undergo these complex procedures. Otherwise,
Yeah.
I mean, shoot, I couldn't imagine it, man.
Yeah. Some of these surgeries I looked up that you could look at these guys who are getting these surgeries, like you were talking about the arm on the face. I think, what they call it, a flap surgery?
Yeah, it's called a Tagliacozzi flap. Actually,
Oh.
it gained a lot of fame in Italy, and Tagliacozzi was an Italian
Okay.
plastic surgeon, but it goes way back,
Yeah.
5,000 years ago. And like anything in surgery, people have done it before,
Yeah.
and then somebody comes along and names it.
Yep.
And
Then they get
known for it. But it's an interesting flap. It's rarely done. I've done one in fellowship, and it's a challenging recovery, but nevertheless, it's very cool.
Yes.
Robbing Peter to pay Paul. That's basically what plastic surgery is. Taking
Right.
tissue from one area to reconstruct another.
Yeah. So that's very interesting. Now, with regard to nose surgeries, I know you do a lot of them. We talked about reconstructive nose surgeries. You obviously do probably even more, I'm just guessing, plastic surgeries, which are just cosmetic. What do you look for? What makes a good nose for anybody who would want to know? When you look at a nose, what do you think, okay, this is what I need to have? This is an ideal, perfect nose. What is that?
Well, I think when patients come and see me and they're having problems with their nose, the biggest complaint is that their nose doesn't fit their face. They have features elsewhere on their body that may be small, or on their face that may be smaller, and their nose is a little bit more prominent. So that's the number one thing you got to look for, is can the nose fit the face? And then there are certain characteristics, I think, especially in Eastern culture, like for instance my culture, we tend to have a little bit more of a dorsal hump, which is a bump on the nose, or a little bit more of a hook nose, and it can vary from minor to major, and that's a very Eastern quality that we're looking to correct. But tip work tends to be a big thing. Sometimes people have a big bulbous tip, whereas the rest of their nose might be nice and delicate. So we need to match the tip to the nose itself. So there's so many variations. The nose is such a complex organ, like I said. It has aesthetic features as well as functional features, but that's what you're looking for. You want the nose to fit the face, and you don't want somebody to come in and say, I want that person's nose, because that becomes a little bit challenging. If a person comes in and says, I want that actress's nose or this person's nose, well, then I really start by saying, well, what is it about that nose that you like? And so we can tailor it to maybe meet some of those criteria, but it also has to be customized for the patient's face too.
Makes sense. And I know you've done some other interesting surgeries. I remember one of them you told me about was, and I actually saw the photos of this. Correct me if I'm wrong. Nitin had a patient who somehow took a chainsaw blade directly to his face, and it actually opened up the wall of the skull. I'm probably not using the proper terminology, but you could see the inside of his cheekbones and the inside of his teeth. I mean, half of his face was missing. I know you worked on that one. How did that one go, Nitin?
Well, this is... how
do you deal with something like that?
This goes back to my fellowship training. I really have to credit all the people that trained me during fellowship to give me the opportunity to work on patients like this. But when I was back at the University of Louisville in fellowship, I was working under my mentor, and we had this patient that came in, and he was using a chainsaw at work, and he hit a knot in the wood, and it snapped back and ended up taking off a significant portion of his face. And this patient was on our service for more than a year. So every fellow that was going through the training program had the opportunity to work with this patient and treat this patient, but it's a complex problem. So we actually had to take tissue from his pectoralis muscle, from his latissimus muscle, from his thigh muscle, all to try and reconstruct the face. And it's a challenging challenging
imagine.
endeavor. And ultimately, at the end of the day, when you do actually have a good result in these patients, or at least get them back to a reasonable state of being and a state of life, it's so rewarding. But it's a journey, and and it's something that's the side of plastic surgery that nobody really gets to see.
Oh, for sure.
And but it's gratifying for me.
I imagine it is. Now, Nitin also had another one where this one was kind of crazy. His patient was a schizophrenic, if I'm not mistaken, and had not taken his medication, perhaps, and ultimately had severed his own penis. And thanks to Nitin, he managed to, and I don't know any other surgeon that could do this, attach the two parts of the penis and made the penis work again. You want to tell us how that happened?
Once again, this was in fellowship, and I have to say this is a team effort. So I was operating with my mentor at the time, and we were in a case, and we were doing a breast reconstructive procedure, and one of the urologists came into our room, said they had a consult for us. And we said, okay, what's going on? And whenever a urologist comes in and says, we have a consult for you, it can only be one thing. It's going to be a problem. So apparently we had a patient. It wasn't me. Who ended up being a very nice gentleman, and you're absolutely correct. He was schizophrenic. This tells you the power of mental illness and the respect that you have to have for mental illness and getting these people back on track. But he had gotten off his meds, and he attempted suicide. He actually had cut himself from ear to ear across the neck. He had stabbed himself in the eye, and ultimately stabbed himself in the nose, and then finally the last act that he had was to sever his own penis. And for the longest time we couldn't find it. And ended up, the general surgeons, the trauma surgeons actually found it in his clothing. The urologists were able to put a Foley catheter in and get the urethra realigned, but then the rest, the vascularity, which is our part, which is our goal, we had to come in there. And so this is 6 p.m. We thought it was the end of the day. We get this consult, and next thing you know, 9 hours later, we're finished putting on his penis. But I have to say, this is once again a team effort. All this stuff, all these reconstructive procedures are team efforts, and I did it with my greatest mentor, Dr. Brad Wilhelmi, who's the chairman of plastic surgery there at the University of Louisville. And I have to say, it was probably one of the rarest operations. It actually happened on the 25th anniversary of the whole John Wayne Bobbitt.
Did it really?
Well. And I had to present it for grand rounds and so on. But nevertheless, it was very coincidental, but it was very rewarding because we actually put two blood vessels back together, two veins back together, put an artery back together, put two nerves back together, all under the microscope.
Yes.
And then ultimately he rehabilitated in the psych ward, and I would round on him daily, and he was the nicest guy in the world. So apologetic about what he had put us through, and we couldn't, he didn't put us through anything. We just wanted to do the best for this guy, and he was so nice. So that was a rewarding case, and it's functional. Yes. It was functional, which was really amazing too. That's the power of medicine and the technology we have these days.
That's pretty amazing, Nitin. And a good reason not to piss off your wives for all the husbands out there, right?
Or yourself.
Yeah, or yourself. Absolutely. Now, you do some other cosmetic procedures as well, Nitin. You do implants in the breasts. You do what, PRP and sculpt? Tell us about some of those.
Yeah, the scope of my practice is generalized cosmetic, reconstructive, and hand surgery. So I do everything from a plastic and reconstructive standpoint. As far as the cosmetic portion of my practice is concerned, I really enjoy breast operations, body contouring, rhinoplasty. The cosmetic aspect of that is great because it's rewarding for patients, and they're elective procedures. Patients are actually coming to see you wanting something, and they have a goal in mind, and I love to target that. I do breast augmentation, breast reduction, breast revisions. All of that's very rewarding as well. As far as breast augmentation is concerned, the technology of breast implants in this day and age has advanced so greatly. We're on the 5th generation of types of implants. Silicone implants have made a comeback and are resulting in greater appearances and texture and feel for the women. They feel empowered when they're able to actually have breast augmentation and have something that they've never really had in their life. So that's a great part of my practice. I really enjoy taking care of those patients. And as far as cosmetic surgery is concerned, there's a surgical aspect to it. So all the rhinoplasty, breast augmentation, body contouring, abdominoplasty that I do is also matched with a non-surgical component to my practice as well. So I have a lot of non-surgical devices in my practice. I've just implemented a whole arsenal of products by BTL. I'm sure everybody's heard of M-Sculpt. It's been on TV. It's been on the Kardashians. It's been on E. It's been on everything that you can possibly imagine. It's using high fem technology, which is high intensity focused electromagnetic energy. In a 30-minute session, this energy is actually passed through your muscles through these devices, and it engages the motor neurons to activate the muscles. So, for instance, a 30-minute session of using M-Sculpt on your abdomen can be like doing 20,000 sit-ups. There's no way you're going to be able to do that on your own. And we're seeing some amazing results as far as the contouring, the definition of the muscle. Now it's been FDA approved for the abdomen, for the butt, so the glutes. You can put it on your...
No more squats, ladies.
Get that booty back. For the thighs, for the calves, and for the biceps and triceps. So not only are we using it for aesthetic purposes, but for functional purposes. Now we're starting to see athletes using it and seeing some improvement in their performance. So those studies are out there, or at least being done. I'm going to try and collaborate with some athletes in town. I want to see the evidence myself. Run some studies on that and see how these athletes are improving in their performance, and see various variables that we can see as far as improvement is concerned. And then, we're doing hair transplantation now for hair restoration.
I'm going to need that soon.
I certainly
I hope
do.
not. I might.
I certainly do. But we're talking about doing that for men and women.
I know some women that might need it too.
Certainly, some women do have some the ability to develop a type of pattern baldness that we can target. But in addition to that, we're starting to use platelet-rich plasma. Platelet-rich plasma is taking the component of your blood, which is the richest component of platelets. Platelets contain the ability to incite growth factors and healing factors. It's the first cell that arrives at a site of injury when you have a cut or a wound or something of the sort. So the technology, people far smarter than me, have come along and said, hey, why don't we take those cells and inject a high concentration of those into areas that might need them, and that promotes healing, promotes stem cell generation, and can actually heal areas a lot quicker. I started using it a long time ago for tennis elbow. Then I started using it in the wrist. Now we're using it in the scalp to promote blood vessel ingrowth. So your hair follicles that are dying off may have an ability to stay a little bit longer. In conjunction with hair transplantation, can actually promote hair growth a lot better. We're also using it for, I'm sure everybody's heard the term vampire facial.
I've seen it.
It can be coupled with microneedling, which is radiofrequency microneedling, using these tiny needles to create micro injuries in the skin, and then infusing platelet-rich plasma to accelerate the healing process around or following that microneedling procedure. So, I mean, plastic surgery, this is why I went back to plastic surgery. It's so fascinating. It's so variable. The possibilities are endless, and wherever you go, if you look on Instagram, it's like one of the greatest things that's searched right now on Instagram is plastic surgery procedures, and there's so many cool things that we can do safely that are FDA approved, that are done by fellowship-trained plastic surgeons like myself. I think it's a very important thing for the population to have access to and realize that we can all be our better self.
Absolutely. Now you mentioned, one of the highest search things, and I think you said on Instagram. And one thing that I thought was interesting, I found interesting, is now we've got, thanks to Snapchat and some of these other social media sites, you can actually morph the appearance of your body. They have a word for it for Snapchat. They call it Snapchat dysmorphia. So people are taking these videos, pictures of their faces, and they look great in the picture. And that's a lot of times what you'll see when you see somebody posting on Instagram or whatever, or social media, Facebook, Snapchat, whatever it might be. And so these people then begin to have this unrealistic expectation of what they should look like. They should look like that. Are you running? And I know it's kind of interesting because Instagram has now said, look, we're not going to allow any filters on our site because we're trying to, keep this body dysmorphia at bay, prevent all that. But some of the other ones like Snapchat allow that. Have you run into any people who have that body dysmorphia?
Absolutely. BDD, body dysmorphic disorder, is very common, especially in the plastic surgery realm.
Yeah.
I think a plastic surgeon needs to be aware of that and needs to be able to address that in a very logical manner, a very sensitive manner when it comes to patients. Obviously, patients are going to come in with unrealistic expectations. I've had patients that come in that say they want to look like this actress or that actress, and I tell them, look, it's not possible. We can meet certain expectations, but you really have to be yourself. You're individual. You are an individual. You're different than anybody else, and that's why we customize the care that we do. But the filter technology has really distorted things nowadays.
Absolutely.
Patients are coming in saying, I want to look like this. I want to, and I have to be honest with them. I say, all right, let me see that picture without a filter.
Yes.
And when you actually sit down and talk to them about what real is and what filter technology is, I'll tell you about 50% of the time I'm able to communicate with the patient and connect with them and start making them realize that, hey, I actually look beautiful without the filter.
Oh, that's amazing.
I just need to, maybe correct this, or maybe it's a skin issue, or maybe it's this. But, you can fix everything. You can fix the contour of your nose, the width of your face, the texture of your skin with these filters, and it's unrealistic.
Right.
But where did it all start? It started from the beginning when publications came out. Looking through magazines and Photoshop, et cetera, But now, in this day and age, it's so commonplace. It's just a button away, right? So, I think it's important to have those conversations. I think you need to talk to a plastic surgeon that respects this and is able to respect the patient and be sensitive to their needs and not just blow it off. But overall, it's a component of my practice, and it always will.
Nice. All right, Nitin, thanks for coming in today. Nitin Engineer, everybody, reconstructive and plastic surgeon here in Las Vegas. Thanks for tuning in this Friday morning, and we'll see you all next week, all right?
Cool.
Take care.
Thanks, Eric.
Yep.